Thomas, thank you so much for joining me tonight. I want to start off by asking you, what does this agreement ultimately mean for Manitobans?
I think what this agreement means for Manitobans is that we are going to see some real progress on some of the missing pieces in healthcare across Canada. We're going to see real action on pharmacare, the prescription drugs that so many of us rely on for our day-to-day health, and dental care for all Canadians. The dental care program is going to be at this point capped for people families who make under $90,000 a year. This will give them access to the full range of dental care that so many of us rely on right now.
You've probably heard from many Manitobans, but what effect does not being able to afford dental care or prescription medications have on families?
Yeah, I mean, that is one of the number one concerns that families who speak to me talk about is the added costs. Of course, many hospital-based services are covered, of course, by Medicare. But when you come out of that, you have these medically necessary prescription drug coverage, and that can be a breaking point for a lot of families. You know, the decision to make is, do we get the required prescription drugs, or do we pay rent for the month? You know, and so a lot of times people are skipping out on those prescription drugs, and that's just not good for people's health. You can say the same with dental care. With dental care, you see people who are making this decision to live with excruciating pain, and at the end of the day, dental health is healthcare. These are things that should be covered in our healthcare system, and it's really good to see parties working together to bring this kind of benefit forward for Canadians.
Thomas, as you well know, there are a lot of health and social challenges across Canada. What would you say to people who believe that there's a better place to spend this money?
I would say to them, let's look at what the last couple of years have taught us. Coming out of this pandemic, how important it is to look after our neighbors, to look after our fellow Canadians, our fellow Manitobans. This is a step that we can take right now that addresses high costs of medically necessary care. If we're able to get that money to people, get that coverage to people in a way that is affordable, we're going to make our communities safer, more prosperous, and more healthy. And that's a win for everyone.
Overall, Thomas, what do you think of this plan?
I think that after 2 years of real difficulty and the last 6 months where we've seen a lot of division, it is really good to see parties and governments coming together to make good decisions for the benefit of all Canadians. I think we needed that, and I think this is a win that is going to be very important for Manitobans, Canadians, and their health moving forward.
Thomas, I really appreciate you joining me on the show tonight. Thank you so much.
Thank you, Marjorie.
Thomas Linner is the Provincial Director of the Manitoba Health Coalition.